Hello everyone and welcome to our webinar series. This webinar is going to cover patient experience. And my name is Peter Harnish. I am the CEO and co-founder of Well IQ. And we've always believed that when patients know they're being heard and employees know they're being valued, that is when you're going to see a drastic improvement in patient experience. And both MEDENT and Well IQ believe in this. So a quick refresher on MEDENT and Well IQ. Well, we partnered recently to bring you the best-in-class patient survey experience that is directly integrated into your EHR. We're able to deliver high survey response rates, we're improving public ratings and reviews, we're giving you the opportunity to increase MIPS points, look at staff-level performance insights, but even more important is the complete integration into the MEDENT patient record. And that doesn't matter how you're seeing that patient. It can be through the telehealth channel as well. In any case, you're going to be receiving a completed survey back into the MEDENT patient record. And that is speaking directly to the patient experience and how we're starting to put that first. So now that that's behind us, let's take a look at patient experience. And really, why does it matter? Well, there's actually some urgency behind it. Right now, consumers are more active and they're more engaged in the experience they're expecting. In the past, they were a little more passive. So it's very important that we're thinking about patient experience. And of course, there's the most obvious reason is that it's just simply the right thing to do. We want to be providing a positive patient experience and we want to be continually improving upon it. A better patient experience leads to better patient engagement. And when you have more engaged patients, you're going to have better patient outcomes. And on top of, again, just being the right thing to do, now you're actually going to be impacting the revenue for your organization because we know there's a direct correlation between improving a patient experience and increasing the revenue for organizations. That could be from quality improvements for reimbursements. It can be through reducing staff turnover, and it can be for improving patient outcomes, which is going to limit the amount of readmissions. And finally, patient experience is the major factor in practice reputation online and off. And in any case, patients are going to be looking for you. They want to already determine where they're going is going to be the best experience for them. Now, the question is, why do we measure it? Well, there's an old saying that says, what gets measured gets done. And that applies to everything. And what I want you to think about is an example of some friends that I knew, and one of them wanted to lose some weight. And when I talked to them about this, they said, yeah, I've got a great plan. And I said, oh, well, have you stepped on the scale yet? And they said, no, I'm a little nervous to step on the scale. And I asked them why. And they said, well, I just don't want to see that number. But the problem was, if you don't see the number, if you don't know where you're starting, you don't know where you need to go. And the same is applicable for patient experience. Some organizations may feel scared. They may know that there's been the odd bad complaint. And maybe they're worried about what's going to come in. Where do we stand right now? But if you don't know that, you'll never know where you're going. So it's really important that we're going to measure the patient experience. And we believe the patient feedback is the main way that you're going to be getting insights on the patient experience because they're going to be coming from the patient, potentially their family, and of course the staff. All of those are the touch points on a patient's journey, and every touch point matters. It could be that they had a great experience. The patient saw the medical assistant and loved them, the clinician and loved them, the appointment person that was scheduling for their next appointment, a great experience. But when they were checking in, there was a poor experience somewhere. And that turned a potentially 5 out of 5 star review into a 1 out of 5. Every touch point matters. So how do you currently get patient feedback? Maybe it's HCAHPS minimum requirements. Some standard mail, an email, a phone call, something where you're just getting the minimum that you need. It could be you have a supplemental survey with questions specific to your practice, your staff, and your expected patient experience. Maybe that's done on mobile as well. We know that when you send a text message out, you're going to get a much higher response rate. It could also be pen and paper. If someone just wishes to give you some feedback, you're going and providing them a way to do it. And of course, there may be no process in place at all. And that is not something to be ashamed of. It is just a fact that sometimes happens. If you look at a very large hospital here in Southern California, what I can tell you is that they do the HCAP minimum, but they also have this. This photo you see shows that they're getting feedback on their staff for people who are going above and beyond with pen and paper into a plastic box. And it's better than nothing. You want to make sure that the patients understand that they can impact their own experience. And why do we do this? Data. Data, data, data. The more data you have, the smarter your organization can be. We want you to be encouraging patients to provide more feedback and provide it as frequently as possible, because the more that you have, the more you can share it across the organization. And that makes decisions and improvements very easy, because now it is no longer subjective. It is very definitive from the patients and the staff members. Now that's going to be affecting training. It's going to affect staffing. You're going to know the behaviors that are important, and you're going to be impacting patient outcomes. And all of that is done through patient feedback, which we know is important, and you know is important. But now we're talking about why is it important? Because this data is driving important decisions. So let's look at a use case. And this is a use case that we are very familiar with. It is one of our clients. And this practice was a busy one. They had some days that they were, of course, very busy, and some were slow. But when they were busy, they were very, very busy. And we knew that the patient experience had been impacted. They had told us that. Accountability was something that was interesting here too, because the management teams thought that maybe the staff could be more accountable. And the staff members felt as if they were being very accountable, which meant there was a clear gap. That can sometimes tie into this idea of a busy practice. And that leads us to the example, which is the forgotten patient. And this happens from time to time. We know this happens. And it had happened to them before, but it also happened to them after they put in a patient feedback example. So this patient was brought in and was waiting to see a doctor, and the patient continued to wait. So the usual outcome here, and what they had seen in the past when this had occurred, was that first, of course, the patient was going to become upset, and they would eventually walk out to complain to someone. However, in this particular use case, the patient was not someone who would do that. They would not normally take the initiative to go out and seek out someone to complain to. They were willing to sit there and wait. Now, a bad experience has many impacts, but if they've sat there patiently waiting and they have not been engaged and they decide that they're having a bad experience, does not matter their age, social media or not, they are going to use word of mouth to talk poorly about their experience. And that has a direct impact on the staff as well, because finally that patient comes out and says that they've been waiting, they've been forgotten, and a bit of the blame game starts to happen of who dropped the ball. It wasn't me. I was over here. You should have done it. Oh, you should have told me. You didn't update this. And that's just a bad environment to be in, because once that staff member does go to talk to the patient, it's probably not going to be in the best circumstance. And we want to make that improved. So what happened in the new outcome? What happened when patient feedback was directly put in place to overcome these hurdles? Well, immediately when the patient walked in, they were told, you have a survey on your phone right now. As soon as you checked in, you're going to get it. And if you have any positive things to say about us, or if there's any problems, you can always use that to let us know. Now, this patient who was waiting in the room, they remembered that. And after waiting for 10 or 15 minutes and thinking, this isn't very good, they decided they were going to open up the survey. And they gave their experience a 1 out of 5 right away, a sad face on our survey. And that sent an immediate notification to the administrator of that location that there was a problem, there was an actionable event. And the administrator, who sometimes isn't directly available, they just happened to be. And they said, you know what, I'm calling that patient right now and I'm going to find out what went wrong. And they did. And they said, hi, we saw that you just gave us a 1 out of 5 and we wanted to see what we could have done better. And the patient said, well, I'm sitting here in the room and I'm starting to feel like maybe the doctors have forgotten about me. And so the administrator said, well, we're going to take care of that right now. We'll be in momentarily. And so they kind of escalated the situation. They said, hey, this patient has been forgotten about. It was true. They went in, and that bad experience now was contained to an internal feedback process. And it was managed, and it was done perfectly. Because now the staff went in knowing that there was a problem that could be fixed. No one was to blame because we were still in a nice little window where it was acceptable. And the opportunity in the end was that it became a positive experience. That same patient asked for a new survey because they wanted to give positive feedback and say they had actually had a 5 out of 5, and they ended up going to an online review site and leaving positive feedback as well. Because we've given the opportunity for the patient now to engage. They're becoming owners of their own experience, and that is how you can start to compete. Because when you're offering this unique patient experience, you're actually offering a competitive point of difference, and that's very important for healthcare organizations. Make your patient experience so great that patients want to seek you out. So what are the actions and measurements? Well, there's a few things you can, and of course, implementing a real-time feedback mechanism is going to be the most important one. That's what we do. That's what Well IQ is part of. We're a way for you to get patient feedback. But there's other ways, and if you find them and they may be a better fit for you, then we encourage you, just get something in place because it's so important. But let us have a chance if we can, because we're happy to do it as well. Focus on the organizational and staff level performance to respond to those actionable events. You know that there may be an actionable event, but you need to actually get the data on it first. Analyze and apply feedback and make patient experience improvements. And then you have to measure it. What is the patient satisfaction score? We have a Well IQ score, but however you get that patient satisfaction, make sure that it's going up. Make sure you're looking at it and reviewing it. What about your public review site ratings? How many of those 5-star reviews have you had? How many reviews overall do you have? Is your staff engagement up? Are the patient outcomes improving? Maybe readmissions are lowering. There are many ways where you can start to measure this and take action. And just like that person who was trying to lose weight, you have to remember that once you start down the process, you need to continually reevaluating. The good part about getting data is that you can continually look at it. If you were losing weight, if you were on a workout program, eventually you would say, okay, this was a good month or this was a good week. I've done good with my nutrition. I've done great with my working out schedule. And just like that, you may make tweaks and improvements and you'd look at what was working and what wasn't. You need to be doing that with the patient experience. It's not something that's going to be able to be on cruise control, but how you get it can be put on cruise control. You can make sure that you're getting the feedback. And if you're doing it in a positive way, if you're doing it in a way that gets you a lot of feedback, then you're going to be able to take the actions. Now, we can't do that for you. You need to have the data and you need to be able to analyze it and make decisions. But it is of utmost importance that it's a consideration for you. It needs to be front and center. So I'll end with MEDENT and Well IQ. Together, we're able to help you strengthen your organization because we're improving what matters to the biggest assets you have, your patients and your employees. And by putting patient experience first, you can really impact your organization. We're the only patient survey that's integrated fully into MEDENT, into the patient record. We have a 30-day pilot for the first 100 accounts to sign up. Some of those spots have already been snagged. And if you license this Well IQ survey and administrative dashboard, you're going to be able to do all the things we just talked about. You're going to have the same outcomes as that use case, and it's going to be something you can do immediately. So I definitely urge you to contact MEDENT at welliq.org. Give us an email there. You can also go to the MEDENT partnership page, and you can email me directly if you want at peter@welliq.org. And if you've already seen the demo, then you can always turn off the webinar right now. But if you haven't, stick around for the next 2 minutes, and I'm going to take you through just a quick example of how we do things so that you can see how we can impact your patient experience. So let's try out the demo. What I want you to do is text the word demo to 858-314-3503. And it's going to give you an example of a patient survey. You're going to get a text message back with a link. And when you touch that link, you're going to be dropped into an example survey. So again, the number and the word to text is in the bottom left corner here. But once you do open it, you're going to see this example, and the first page is just an overview of why you should be giving some feedback. We always like to put an incentive in here. We suggest it, maybe a quarterly patient appreciation drawing. And then at the bottom, you see the language. So there's many different languages we can do. By default, we have English and Spanish, but we can customize that. And you can change it quickly and go back to English if you like. And this is a patient journey that has 3 different touch points: the reception, the medical assistant, and the clinician. So in this case, I'm going to say, you know what, I saw Nancy, I remember her. And as soon as I proceed to the next screen, I have the opportunity to choose endorsement badges, which represents the behaviors that are important to us, what we expect from this positive patient experience. And it's a way for us to measure up against it. By default, I think the ones you're seeing are going to be all positive, but we can customize these to be non-positive. But of course, if you scroll down, after I choose a few of these badges, I can always write some feedback in the bottom that maybe is going to reinforce the great behavior I saw, or it may explain a bad experience I had too. Once I've done that, now I can start to proceed through. So the medical assistants, if you wanted to, you could choose one of them. Same with physicians. There'll be a screen on the facility, and then eventually we get to this: how did we do overall? And you see the 5 faces here. Now, if I were to select the sad faces, it would actually create that actionable event, and we would be notified by it. In any case, once you move on, you may see this. It's a spin for raffle entries. So you can spin the wheel if there was an incentive set up. And on the last page, you're going to have the opportunity to go out to public review sites and leave your review. And this can be Google, Yelp, Facebook, whatever you may want to put in there as an actual practice. So it's very simple. It's the easiest to use survey that gets you the most data that you can possibly have about staff, departments, and the organization overall. I'm also going to quickly run through just a couple of the pages that are available should you want to log into the actual Well IQ dashboard, because you're able to see a lot here. It shows you the number of surveys you're sending out, which is that top portion of this dashboard. It has your overall patient satisfaction or your Well IQ score. It tells you how many surveys have been sent and completed, and what are the top behaviors, the top endorsements that the patients have been giving your staff. You can then also look at the department and which one has been receiving the most engagements, as well as the staff, so that you can see who's been excelling this particular month. And at the bottom, again, addressable events where you want to take action. One of the reports we really like is the most engaged staff, because it starts to show by location, by date range, what are the behaviors that the staff members are receiving and who's receiving the most of them. This can impact training and so much more in your organization, but it's here on a simple screen where you can report and analyze on it. We have the overall patient satisfaction report where it breaks it down by location. Again, a great measurement is just how are your patients responding, because this is going to give you that subset of patients that you'll be able to start identifying where you're going right and where there could be some improvements. And finally, I just like this report as well. It is the most used badges report, and it shows you what are the behaviors that are resonating the most with your patients. And just like you see the ones that are resonating, the ones that are lower on the scale, they may be areas that you would like to improve on. So a great way to start seeing how patients are engaging with you and what they believe is the positive impact you're having. All of that ties back to a great patient experience, being able to get feedback on it, and then taking actions on the feedback you've received. And with that, I want to remind you again that it's medent@welliq.org. Please email us. We're happy to have more conversations. We're happy to describe more of what we do, take you through demos, but we're very excited about our partnership with MEDENT and how we're impacting patient experience as well as many other areas. So stay tuned for more of our webinar series. We have more coming up on topics such as organizational culture and marketing, both very exciting to listen to. And again, I want to thank you for taking the time.